Excellent.
Well, good afternoon. And again, I would like to thank Dr. Chris Lowthert for his wonderful work in German New Medicine. This is part 2 of the skin. And Chris, would you take it away?
Sure, Kathleen. Let's get into the skin now. And we're going to first start off with some basic anatomy of the skin. And we're going to look at the biological conflicts associated with the area of the skin, and then also what we should expect in the healing phase. Okay. And so there are 2 layers of skin that we're going to look at today. The first layer is that inner skin known as the corium skin, the dermal skin, the dermis layer. And that includes the sweat glands and the sebaceous glands, as you can see here in the diagram. And then we have the outer skin, the outer covering of the skin, the epidermis, that's made of epidermal tissue, squamous epithelial tissue. And that's divided into a little bit of more layers, but in general, we got the inner skin and the outer skin, okay? Today, we're going to first start with the inner skin, the corium skin. Now, there we go. We're going to look first at the brain and where the corium skin is controlled in the brain. As we talked in past interviews, that the brain is an integral part of the 3 components that make up a biological unit. We have the psyche, the brain, and the organ or body, right? And so the brain is that intermediary component from this in the psyche that connects the psyche with the body. And what Dr. Hammer has brilliantly done over the years using the CT brain scan, he was able to map out the brain and all the control centers for all the different organs and tissues of the body. And so when we're talking about the corium skin, we're going to be talking about the area of the brain known as the cerebellum, and that's located back here in the brain. Actually, right here is the cerebellum. You can see that here. We got the brain stem and then the cerebellum. So we're going to be focused here for now on the cerebellum. And in the cerebellum, the corium skin, we got the left side of the body illustrated here, which is on the right side of the cerebellum. And we have the right side of the body, the corium skin, on the left side. And so we have a crossover correlation here in the brain, okay? And so a skin condition that affects the right side of the body is going to have a visible lesion in the brain at the level of the cerebellum that's located on the left side of the cerebellum right here. You see that? You see my marker? Yeah. And then the same applies if we have a corium skin program running on the left side of the body. In the CT brain scan, we're going to see a lesion on the right side of the cerebellum. So there's a crossover correlation. And that brings us to the significance of our biological handedness. Our biological handedness is actually determined within 14 days of conception and during the first cell divisions Dr. Hammer discovered. And our biological handedness can be determined by the simple clap test. We clap our hands one on top of the other, and the hand that is on top is going to indicate our biological handedness. And the significance of this is that for a right-handed person like myself, when I experience a situation related to a partner, a spouse, a friend, a colleague, I'm going to experience it on my right side of my body. Versus if I experience a conflict that is related to my mother or child, I'm going to experience on my left side of the body. And so how we perceive the situation and who it's involved, it's going to determine if the symptoms are going to manifest on the right side of the body or left side. And we're going to get into more of this and some examples of this with the skin condition. But the biological handedness is the reason why we develop a dermatitis on the right cheek and not the left cheek, right? Or we develop a herpes or a cold sore, like right at the midline, right? You see this sometimes. People, you can see the demarcation of the midline. The herpes is just on the right side and not the left side, right? So this is the significance of biological handedness. Now, if the person is left-handed, right? So they're clapping and their left hand is on top, then their left side of the body is related to a partner side. And then their right side of the body is a mother-child related conflict, okay? And so it's reversed. But this is something that needs to be determined at the very beginning of our investigation. What is your handedness? Are you left-handed or right-handed? And that will help us uncover the conflict and who it's involving, okay? Now,
So if a left-handed person has developed, say, shingles on their left leg, that would mean that it's a partner.
It's quite possible. It's possible, and we'll get into this because it could be a generalized conflict, meaning it's not related to mother, child, or partner, but it could very well be, and you keep this in the back of your mind as we investigate, it could be related to a partner. Okay.
Okay.
Yeah, you're right. So now let's look at the biological function. And this is, again, so important and so beautiful to comprehend and recognize. Because the biological function is going to be intimately related to the biological conflict theme, meaning that, as we said earlier, the fifth biological law, it's the biological program is designed to assist us. So guess what? When the biological program kicks in, the biological function will increase to give us that upper edge, that upper hand, right? So there's going to be an enhancement in the biological function. And that could be applied to everything, every tissue of the body, okay? So, for example, we can look here at the biological function of the corium skin is to protect the organism against injury and attacks. It has a protective function, okay? Now, let's look at the biological conflict. And there we go. The first one here, oh, let's see. I'm there. I got a better view now. I got it. Yeah. So the first conflict that we're going to look at is an attack conflict. So as we said, the corium skin, the function is to protect us from injury and attack. Well, the conflict theme that affects the corium skin is an attack conflict. So you feel that you're being attacked. This could be literally being attacked. Somebody can experience maybe a punch in the gut, right? And develop a condition in that area of the body on the skin, or it could be a verbal attack. So it could be figuratively. They're being attacked from behind, which would then manifest on the back of the body, right? So the conflict theme is feeling attacked, being attacked. Now, this attack conflict could also be activated by a medical procedure, like a biopsy or vaccination, or some people may know about the procedures of pulling the fluid off the lungs. And so we can easily, or a mastectomy is another very common scenario that activates an attack conflict, right? And so a medical procedure can easily activate this biological program related to the corium skin. It's also can be described as a disfigurement conflict, a disfigurement conflict. And so to stick with the example of a mastectomy, the woman could have a mastectomy and now have a disfigurement conflict because of how she looks, right? Whereas we're going to see later, acne, the adolescent develops some acne on their face, and they could also have a disfigurement conflict. Okay, so there's an aspect of this biological conflict which can also be described as a disfigurement conflict, along with the attack conflict. And lastly, this conflict could be described as feeling unclean or feeling soiled. Okay, like something's dirty. You don't want to touch it. It's dirty, right? Or I feel dirty, or I feel soiled. Okay, this could very easily be related to contagious disease. So somebody you come in contact with and you know that has a certain disease, and you have the belief of contagion running in your psyche, that event can easily activate this biological program. Do you follow? So contagious disease, and I want to really emphasize this again, because interesting, when I was going through this material and putting it together, there's so many correlations to our current shit show that it starts to make sense. So if, as you said, if you embrace the terrain theory, thankfully you're leaving this germ theory, contagion theory behind, but you can see how that belief of contagion could activate a special biological program and develop symptoms of that nature related. And so the fear of infection, the fear of contracting a disease can affect a whole population. Okay. And we're going to speak a little bit about the Great Plague that occurred in the 14th century and see the similarities of our current event. Okay. So we're going to just put that on hold for now. And we're going to just continue with the corium skin, and we're going to start with the conflict active phase. What happens at the organ level when the shock happens? So as you see here, actually, do I have a pointer? I don't know if I have a pointer. I just screwed up my screen. Sorry. Hang on.
All right.
Do you see? Yeah.
Can you see that's my pointer. Can I use it for you?
Okay. Yeah, you can. So we can all see the diagram here. This, again, we're going to keep this diagram up so we can keep going back to it. So we're in the conflict active phase right now. So we have an unexpected shock. Subjectively, we perceive it as an attack conflict, but we don't know at that time, at that moment, that it's an attack conflict because it's subconscious. We don't have many symptoms at that time, at the moment it happens, okay? So the psyche perceives the conflict shock in a split second, but we don't know how we perceive it until the symptoms start to arise, okay? You follow? So in the conflict active phase, we have increased cell proliferation occur, okay? Because of where the corium skin is controlled by in the brain. As we see up in our diagram here, that, oh man, this is going to bug the heck out of me right now.
What would you like me to point to?
Yeah, but I got something else up on my screen that's hindering me.
Oh,
Hang on a second. All right, I'm going to deal with it here. So as you can see here in the diagram, there is what we call the mesoderm, the old mesoderm layer, right? That's associated with the cerebellum. And the cerebellum, part of the tissue that's in the controlled by the cerebellum, is going to respond to the conflict shock with cell proliferation, okay? And that cell proliferation, when it's involving the corium skin, is going to be what we call a melanoma. A melanoma. And you can see a picture here of an example of a melanoma. Oh, beautiful. I got it. Got to figure it out. Excellent. She was helping me on that one. So a melanoma, skin cancer, right? So there's cell proliferation going on because this area of the body is controlled by the cerebellum. And all tissue controlled by the brain stem in the cerebellum is going to respond with cell proliferation in the conflict active phase. Now, what about UV radiation from the sun? Does that cause skin cancer? Well, that's a very common theory floated around out there, that radiation from the sun causes skin cancer. Well, the melanin that you can see in this picture here, the melanin is the pigmented tissue that is in the corium skin, will increase if somebody is exposed to sun on a regular basis, right? We call it a tan. And some of us get a better tan than others, right? But the skin cancer, the melanoma, is not caused by the radiation in the sun, but instead it's caused by an attack conflict. Now, what is causing the melanoma in relation to, quote unquote, the sun and the radiation? Here we go. Wait for it. It's the fear of skin cancer from the sun that makes people susceptible to developing melanomas after a burn, after sun exposure. And it's also the decrease of the fear when somebody puts the suntan lotion on. They decrease their fear of skin cancer when they put the lotion on. And so you could see the role of fear here and how it plays out.
so Chris, could we also say that if there is severe damage to the skin, say with a very serious burn, that DNA damage of the actual cells that could therefore be the perfect site for a shock, an unexpected shock to then situate, because there is this unexpected shock and this conflict that is happening. And so it's like this perfect marriage of all the elements.
Well, just step back, Kathleen, just think about it. It's an attack conflict.
Yes.
Right. And so if the person feels that they were attacked by the sun after they got a burn, yes, the melanoma could very well, the skin cancer can very well manifest, right?
Right. But if there was then an unexpected shock that is the emotional shock over top of that, then that could situate it in the skin, on the skin, in that particular person. So it would, are you understanding what I'm saying? First, there's the attack by the sun. But then there is an emotional stressor that occurs
Well,
that,
it has to be, there has to be an unexpected distress
yes,
related to the sun and the sunburn, right?
okay,
Because I've been burned plenty of times in my life, plenty of times, but I don't have skin cancer,
mhm,
right? Somebody else could get burned. And yes, if they have the belief running in their psyche that overexposure to the sun causes skin cancer, they are more susceptible, more vulnerable for this program to be activated.
right, but if there is then, maybe there's not even the thinking that there is, that they're going to get skin cancer from that, but let's say within a few weeks of that extreme exposure to the ultraviolet rays, then there is another unexpected shock. And
Well,
then,
that's a different scenario then we're talking about.
right, but
That could very easily happen. Yeah, there's an unexpected shock. And again, they could be vulnerable to perceiving it subjectively as an attack conflict. Yes.
okay,
That would mean there would be, the melanoma you're saying comes about, right? So
yes,
if the melanoma comes about, then we know that it was an attack conflict,
I
right?
see, okay.
Right.
Mhm.
But see, let's just finish with this here though. So people that develop melanomas and they're running with the narrative that it's the radiation from the sun, what explains melanomas developing in certain areas of the body that haven't been exposed to the sun,
Right,
right? So I'll leave that with you. How about this one?
wow,
Here we go. So now we're moving into the healing phase of the melanoma, okay? So the healing phase is, as I said earlier, the part that kicks in after the resolution within the psyche, okay? So after the attack conflict is resolved, the healing phase kicks in. And what happens in this phase at the corium skin level is that fungi, microbacteria, and or other bacteria remove the extra cells that are no longer needed because the attack conflict has been resolved. So we see here that the body will enhance the biological functioning in the conflict active phase, protect the skin, protect the organism. And then once that attack is gone and once it's over, then that extra tissue is no longer needed. So our little helpers that live symbiotically with us will decompose that extra tissue, okay, that's no longer needed. And then the melanoma starts to change in texture, in shape, and it even might bleed. And if it opens up, it may even have a smelly discharge. And so this is one thing I remember in chiropractic school in pathology is they say, if that melanoma, if the borders start to change and it starts to get discolored and it starts to bleed, this is a carcinogen, or not a carcinogen. This is carcinoma, right? It's no longer benign, but it's malignant now, right? And this is where the whole idea and concept of benign and malignancy comes in. So when that melanoma starts to decompose, conventional medicine it says, well, this is a problem. This is malignant cancer tissue, skin cancer. Now, if there's conflict relapses due to tracks or triggers, one of the things that will continue to happen is the melanoma will grow. Okay. So if they continue to have that attack conflict present in their environment, then we'll expect that melanoma to get bigger. right? I don't know why my slides aren't working. So let's look at acne. Let's look at acne here. And then acne is related to the corium skin. And oftentimes it comes out on the face, right? And oftentimes it's adolescents that experience this, right? And so in the conflict active phase, the skin appears bumpy. But then when the healing starts, there's inflammation, swelling, redness, and those pustules are filled with pus, yellow pus. We're very familiar with this, right? So what's going on here? Well, this individual has experienced an attack conflict. And because it's on the face, it could very well have been a verbal attack. Somebody was yelling at them, right? Some adult may be reprimanding them. Some authoritative figure may be yelling to tell them to stop doing something, right? A parent, a teacher. And they activate this attack conflict, and they develop these lesions on the face. And then they start seeing this in their mirror. And because particularly adolescents early on are very concerned with their appearance, right? I'm having a real hard time now with this technology that's supposed to take us into the new age. But anyways, adolescents are more vulnerable because they're concerned with looks. And also at this point in our life, there's more confrontation going on, right? And so we can see this is a common scenario where an individual, a boy or girl, can develop a skin condition called acne, right? Now, remember the disfigurement conflict, right, is also part of this. And so they could have an attack conflict because there was a confrontation, and then they go into healing and they see all this pus and swelling, and they can also have a disfigurement conflict now, right? And this is the reason why it often becomes chronic in individuals. They see their face and they're upset with how it looks, and it just feeds into this biological program, right? And so the disfigurement conflict could delay the healing, right? It has nothing to do with hormones, nothing at all, because there's many adolescents that never develop acne, or maybe develop a pimple here and there, right? So it has nothing to do with imbalance in the hormones, and has everything to do with this experience that is so common for younger people and also adults too. You know, adults can have acne, but it's not as common, right? So let me tell you a real quick story, a firsthand story. I know a couple folks have asked me to share some real life scenarios that I've experienced in my life in regards to German medicine. I could tell you right now, after over 15 years of working with this and experience, I got a whole bunch of them, but I just haven't wrote them down and haven't really shared them much with YouTube and whatnot. But I want to talk about this 14-year-old male that I know named Mike, right? We're going to just call him Mike. And he developed really bad case of acne on his back. And then it spread to his face, okay? And this occurred, he's 14 now, this occurred 2 years ago. So he was 12 years old. Just coming into that, you know, that time, right? At 13, the hormones are, yes, they're starting to kick up, and he's a fairly big guy. Well, the issue with the back, we discovered through talking with his mother, and his mother is a single mother. She lives with Mike by himself, right? Michael's father isn't in the picture, so it's a single mother and her adolescent son. which is a very common scenario in our society right now. And it was determined through talk, conversation, and listening to Mike explain what he was feeling, that his mother is constantly on his back, constantly yelling at him for being on the computer too long, playing too many video games, and constantly attacking him on it. And he described it as, she's constantly on my back, man. She can't get off my back. Now, it's more of an attack. So there's this verbal attack component. And we're going to see that the skin rash, like get off my back, is a little different. So I want to be clear with the syntax here. This is feeling attacked from behind. Oftentimes malicious talking behind one's back is associated with this, right? And so the skin eruptions happened on the back, and then they began to erupt on the face. And then it was this disfigurement conflict that kicked in, because a lot of the other things, the verbal attacks from behind, subsided with the awareness of the true nature of the symptoms, right? This is the beauty of German New Medicine. You can't ignore this. And as parents, it's not our fault that our child has a DHS or experiences a conflict shock that involves us, because we can't prevent, we can't influence, we don't know how our kids are going to respond to us. But once we do know the true nature of the symptoms, then we can play our part in helping resolve it and then helping the healing along, right? And that's what's happening right now. And it's a slow process because of the disfigurement. And so one of the things that I shared with Mike one time when we were just driving along is I suggested that he stop looking at his back in the mirror. Stop looking at it as much as you can. Yes, let mom apply the lotions and the herbal remedies that support the natural healing, but stop looking at it. Now, it's a different story with the face, because obviously if you have a mirror in your bathroom, you're going to see it. But knowing that, you know, I might not want to be looking at myself too much in the mirror because it could be feeding in this disfigurement, is something that we want to keep in mind. And then it's also changing his perception of the acne, changing his perception as to what it's all about, right? That's the work that he is in the process of doing, and it's working because his condition is healing slowly but surely, right? But he has to change how he's viewing himself when he looks in the mirror in order for things to slowly heal up. And they are healing up. We can see it, but it's a long process, and we can see why that is. You know, this is a scenario that is very common, and, you know, it's going to take time. And often that's really what it comes down to. As the adolescence grows and matures, then the acne starts to disappear, right?
I would think too, though, Chris, that we could supplement with a very clean diet, because many adolescents don't eat very well. So if we're talking a lot of you know, juicing, celery juicing in the mornings, and
Well,
kale
here's the thing.
shakes and
Here's the thing with that, Kathleen, that we got to be careful. And I haven't mentioned this, but because there's a decomposition going on, right? So the cell proliferation now is being decomposed. There is a loss of protein that's happening. And so he has to be, and adolescents have to be aware that they need to be getting an adequate supply of protein to help support the body, because there's a loss of protein happening. Now, I can assure, and I'll speak just in this case directly, Mike has a very clean diet and always has had a clean diet. And yet he still has the situation that's going on, right? So again, it's yes, and he continues with the supportive diet. He continues with different ointments, herbal ointments that are known to facilitate and support the healing of skin conditions. And he's just one day at a time, right? One day at a time. So now let's look at the Great Plague. The Great Plague, what was going on back then, right? Well, there was a major fear of disease happening, right? Major fear, because look at the picture here. I mean, you see somebody walking in the streets or know somebody that has this, certainly can cause a lot of fear. And then depending on what the narrative is at that time, well, there you go. You got a perfect storm. But what was going on? And what was it really? What was really killing people at the time? Because it's been said that over 30 to 60% of the European population died during this period of time, right? And so in this picture here, we can see that this is an attack conflict because of the discoloration, the black, right? So there's that pigmented discoloration. So we know there's an attack conflict. But what was killing people? This picture here would be described as the bubonic plague, right? You follow? The bubonic plague. But in actuality, what was happening is on top of the attack conflict, people were having death fright conflicts. And they were actually dying. And you can go and look in the records. The people that died actually didn't die of bubonic plague, but they died of pneumonic plague. Pneumonic plague. They had pneumonia on top of the skin condition. And pneumonia affects the lungs and they fill up with water because there's an existence conflict going on. Water retention. And Dr. Hammer found that when there's water retention in combination with other tissues of the body that are in healing, that can complicate factors, particularly those vital organs in the body, like the heart and lungs and the liver, right? And so the symptoms of the pneumonic plague was bloody sputum, coughing, right? And so what was really driving this Black Death was ultimately the fear of the plague. The fear of the plague that created the death frights that affect the lungs, right? How about smallpox? It was said that smallpox wiped out all the a good portion of the population of the native peoples here in North America when the European settlers came to town, right? So what was going on here? Was it contagion? No. As we can see in this picture here with smallpox, we got pus-filled pustules, right? What's that about? It's an attack conflict. Well, we can go back and read how that scenario came about, right? There was a lot of attack conflicts going on. But what did they die of? They didn't die of these skin lesions. They died of pneumonia again, right? And so we can see the role of these other biological programs, particularly the ones related to the vital organs, how they can be activated when there's a certain narrative running in the population, right? And so this pneumonia is the lungs is not only there's a death fright, there could be a death fright going on in the lungs, but oftentimes it's related to territorial fear on top of it. So there's a territorial fear combined with a death fright or combined with an existence conflict that creates water retention in the lungs. And that water retention in the lungs is diagnosed as pneumonia. And so many people that died of quote unquote smallpox actually had pneumonia, and it's in the record. It's in the record. So we can see here a commonality going on with so-called epidemics, right, Kathleen? Based on the prevailing narratives at that time. So let's look at shingles. Because you brought that up
I did.
a little bit ago. Did you have a challenge with shingles yourself?
Well, in the past, I've noticed that I've had very small bouts with it. And then when I had a dog, Rose, who adopted me and gave birth to 8 puppies, it was very stressful. And I had a very severe attack of it. And recently spoken with my brother, who has been dealing with it after the loss of a kitty that meant a great deal to him.
All right, I'm going to stop getting frustrated because I don't want a sinus program running after this talk here, and I don't need to be sneezing like crazy. So I'm going to keep my screen like this with my PowerPoint because it's for some reason it's not working. So shingles, what are shingles? Well, shingles look like this here. It's swollen, it's red, and there's blisters filled with pus, right? And also there's an accompanying pain that's very characteristic of tissue that's controlled by this area of the brain. And it's a sharp, stinging pain. And so women who are healing from glandular breast cancer, the breast gland tissue is actually controlled by this area of the brain also, and it derived from this old mesodermal tissue, also experience this type of quality of pain. So this is a quality of pain that one takes note of because it guides us to the tissue in the brain area that's involved, right? So this sharp stinging pain is very characteristic of shingles. So what's going on here? Well, let's first start with the prevailing narrative. Here we go. We got a virus coming into the picture, and in the prevailing narrative is that the adult who develops shingles must have the virus that causes chickenpox, and it's now stopped becoming dormant and has now come back and is festering as shingles, right? So here we go again with these mysterious viruses in the prevailing narrative. So what's happening here? Well, it's again an attack conflict. And based on where it's at in the body is going to determine how it was perceived, right? And so we can see here that it looks like this was on more of the torso, right? And it's along a certain line here. And it could very well have been an attack conflict targeted to that area of the body, right? And so what happens here is that because of the confusion that's installed here on the, and they're saying it's chickenpox and it's caused by a virus and it runs on a certain nerve, it becomes very difficult to identify exactly what was happening, determining what was the conflict. And so when somebody has shingles, you're best to let go, break away from that association, and kind of reflect upon the potential attack conflicts or disfigurement conflicts or feeling dirty, feeling soiled conflict, and see how that plays out, how your memory kind of gets directed towards an experience, and see what what comes about. So yeah, do you want to add anything to this? Another
Well,
thing too, actually I have some notes here about this. Another thing is that the shingle rash can not only, it could be related to the, well, it is related to the corium skin, but it could also be simultaneously related to the epidermis at the same time. And so we're going to shift gears into our next section here on the epidermis, but you are going to see that the epidermis can be also affected in this shingles, quote unquote, presentation.
Hmm.
So we're going to move now to the epidermis. I don't know if you want to take a moment to pause, but we're going to get into this, and we got quite a slides to cover. But let's we finished up with the corium skin. And we know now that the corium skin responds to the conflict with cell proliferation. What we're going to see now is that the epidermis, the outer covering of the skin, responds differently to the unexpected shock. Good.
now we're going to move to our part 3, the outer skin, the epidermis.